What is D1D to lymph node dissection? Imagine you're trying to clean out a garden to get rid of weeds. In stomach cancer surgery, doctors do something similar by removing lymph nodes that might have cancer cells. These procedures are called D1 and D to lymph node dissection, and they help control the disease and improve staging. D1 dissection is like trimming the weeds right next to the plants. It involves removing the lymph nodes immediately surrounding the stomach. These are called paragastric lymph nodes and are located along the lesser and greater curvatures of the stomach. The removal usually includes stations of lymph nodes numbered from 1 to 7, depending on the type of stomach surgery. This approach is less extensive but still important for catching cancer spread early. D2 dissection takes it a step further. It includes all the lymph nodes removed in D1 but also targets those along major arteries that supply blood to the stomach. These arteries include the left gastric artery, the common hepatic artery, the splenic artery, and the celiac trunk. The lymph nodes along these arteries are numbered from 8 to 12, and removing them helps ensure that more potentially cancerous nodes are taken out. This more extensive surgery aims to improve the chances of removing all cancerous tissue, especially in more advanced cases. The main reason for doing a D2 dissection is to get a clearer picture of how the cancer has spread and to remove as many cancerous lymph nodes as possible. This can help with more accurate staging, which guides further treatment like chemotherapy. However, because D2 dissection involves removing more tissue, it is technically more difficult and can carry higher risks of complications, such as bleeding or injury to nearby organs. These risks are higher when the surgery is done in less experienced centers, or if additional organs like the spleen or pancreas are removed. Research shows mixed results on whether D2 dissection improves long-term survival compared to D1. For some patients, especially those with more advanced lymph node involvement, D2 might offer better control of the disease. But because of the increased risks, the decision to perform D2 depends on the patient's overall health, tumor stage, and the surgeon's experience. Many guidelines recommend removing at least 15 to 16 lymph nodes during surgery to ensure accurate staging, and D2 dissection often helps achieve this goal. In summary, D1 dissection is a more limited removal of lymph nodes close to the stomach, while D2 is a more extensive procedure that includes nodes along key blood vessels. The choice depends on the individual patient's situation, the extent of the cancer, and the surgeon's skill. Always remember, each case is unique, and treatment plans should be discussed thoroughly with healthcare professionals who can tailor the approach to the patient's needs.